everyone, how are you feeling today? I hope you are all in good health. I am Ramalachmi from SM Science Alamsha. Are you ready with your textbook, notebook and stationery? Let's get started. Pupils, today we are going to learn about the menstrual cycle from Chapter 4, Reproduction in the Science Form 1 textbook. By the end of today's lesson, you should be able to 1. Communicate about the menstrual cycle and the sequence of changes in the uterus lining during menstruation. 2. Relate the fertile phase of the menstrual cycle to the process of fertilization. And 3. Justify the importance of personal hygiene during menstruation. Are you ready?
The color of your period blood tells about your health. According to the American Academy of Obstetrician and Gynecologists, your period can be used as a vital health sign. Anything from the length of your cycle to the textures and colors that you see may indicate something important about your health. What you see on your pad or in the toilet bowl is a mixture of both blood and tissue from the lining of your uterus. That is why the color and thickness are not the same as the blood flowing in your veins. Black blood. This color is related to brown blood, which is old blood. The color resembles ground coffee. Black blood is associated with the beginning or end of your period. When your flow is slow, the blood may take longer to exit your body. When blood stays in the uterus longer, it may become brown in color. This blood may also be leftover blood from your last period. Lochia. The bleeding that women experience for the first 4 to 6 weeks after delivering a baby is called lochia. Lochia may be pinkish or brownish in color. Dark red. Your period may start with bright red bleeding. This means that the blood is fresh and is flowing quickly. The color of your blood may stay this way throughout your whole period, or it may become dark as the blood flow slows. Dark red blood is associated with the end of your period. You may also see this color towards the end of your normal menstrual period as your blood flow slows. Lochia. The bleeding after delivering a baby starts out heavy and may contain clots. It may appear dark red in color for the first 3 days before changing to different shades and textures. Pink. Your blood may appear pink in color at the beginning or end of your period. This lighter shade most likely indicates that the blood has mixed with your cervical fluid. Pink blood is associated with lochia. From day 4 onward, lochia may be pinkish or brownish in color. Low estrogen. Sometimes pink menstrual blood may indicate low estrogen levels in the body. Estrogen helps to stabilize the uterine lining. Without this hormone, you may shed the lining at times throughout your cycle, leading to spotting of various colors, including pink. Mid-cycle spotting. Your menstrual blood may be pink in color around ovulation time. Orange. When blood mixes with cervical fluid, it may also appear orange. As a result, you may see orange discharge for the same reasons you see pink discharge. Orange blood is associated with infection. Any abnormally colored or unusual discharge may be a sign of bacterial infection or sexually transmitted infection, STI. Gray. Seeing gray or off-white discharge is a reason to call your doctor. Gray blood is associated with infection. This color may indicate that you have an infection that is just starting, like bacterial vaginosis. Other signs of infection include fever, pain, itching, bad odor.
Can you see these pictures, pupils? Have you seen these products in the aisles of your favorite grocery shops? Do you know what it is? Yes, you are correct. They are sanitary pads. Do you know what a sanitary pad is? Yes, a menstrual pad or sanitary pad is worn by a woman when menstruating to absorb menstrual discharge, thereby protecting clothing and furnishings. Do you know when menstruation happens? Pupils, women will experience menstruation when they reach puberty. Do you know at what age girls will reach puberty? Girls will reach puberty when they are between 10 to 12 years old. And the menstruation will stop when she reaches menopause, which is around 48 to 55 years old. Okay, pupils, what is the meaning of menstruation? Menstruation is the breakdown of the lining of the uterine wall, which is discharged together with blood, unfertilized ovum, and mucus through the vagina. Menstruation marks the beginning of the menstrual cycle for each woman. Now, we are going to look at this colorful chart. Can you give me the name of this cycle? Yes, you are right. This is a menstrual cycle. What is the menstrual cycle? Let's take a look. Menstrual cycle refers to a series of changes that occur in the uterine wall and the ovaries. It also involves the formation and release of a mature ovum. This cycle is controlled by the brain and the endocrine system, which secretes hormones. Menstrual cycle normally lasts for 28 days, but this differs between individuals. Some of the factors that can affect the menstrual cycle are nutrient intake, abrupt change in body weight, emotional changes, and mental pressure. Pupils, how many phases can we see in the menstrual cycle? Good job! As we can see here, there are 4 phases in a menstrual cycle. The first phase is the menstruation phase. The second phase is the repair phase. The third phase is the fertile phase. And the last is the fourth phase, which is the premenstrual phase. Let's take a look at all these phases one by one. The first phase is the menstruation phase. The phase occurs during day 1 to day 5 in the menstrual cycle. During this phase, the uterine lining breaks down as menstruation begins and is discharged together with blood, unfertilized ovum, and mucus. The second phase is the repair phase. This phase occurs during day 6 to day 11 in the menstrual cycle. The uterine lining starts to rebuild and thicken. Blood vessels in the uterine lining are formed and are ready to receive the implantation of fertilized ovum. The third phase is the fertile phase. This phase occurs during day 12 to day 17 in the menstrual cycle. During this phase, an ovum is released from the ovary on the 14th day of the menstrual cycle. This process is also known as ovulation. The uterine lining continues to thicken. Fertilization is likely to occur if sperms are present. The last phase is the premenstrual phase. This phase occurs during day 18 to day 28 in the menstrual cycle. The uterine lining continues to thicken and becomes richly supplied with blood vessels. Implantation of an embryo is ready if fertilization occurs. However, if fertilization does not occur, the menstrual cycle will repeat.
You may see a variety of colors and textures with your periods, even if you are healthy. If your period lasts longer than 7 days or is very heavy, make an appointment with your doctor. Other reasons to make an appointment to see the doctor would be if your period cycles are irregular or they change dramatically in length from 1 month to the next. If your cycles are shorter than 24 or longer than 38 days in length. If you haven't had a period in 3 months or longer. If you have considerable pain and other unusual symptoms that accompany your bleeding. If you bleed between periods. Food that you can eat and avoid during your period. Many people have uncomfortable symptoms during menstruation. Some foods can lessen these symptoms, while other foods can make them worse. Here are the examples of food that you can eat and some which you should not eat during your menstruation. Water. Drinking a lot of water is always important, and this is especially true during your period. Staying hydrated can reduce your chances of getting dehydration headaches, which is a common symptom of menstruation. Drinking plenty of water can also stop you from retaining water and bloating. Fruit. Water-rich fruits such as watermelon and cucumber are great for staying hydrated. Sweet fruits can help you to curb your sugar cravings without eating a lot of refined sugars, which can cause your glucose level to become very high very quickly. Leafy green vegetables. It is common to experience very low iron levels during your period, particularly if your menstrual flow is heavy. This can lead to extreme tiredness, bodily pain, and dizziness. Leafy green vegetables such as kale and spinach can boost your iron levels. Spinach is also rich in magnesium. Ginger. A warm mug of ginger tea can improve certain symptoms of menstruation. Ginger has anti-inflammatory effects, which can soothe aching muscles. Ginger can also reduce nausea. A few studies have confirmed this. Since it is safe and relatively cheap, it's worth trying. Don't consume too much ginger though. Consuming more than 4 grams of ginger in one day can cause heartburn and stomach aches. Chicken. Chicken is another iron and protein-rich food, which you can add to your diet. Eating protein is essential for your overall health, and it can help you to stay full and sated during your period. Fish. Fish is rich in iron, protein, and omega-3 fatty acids. Fish is a nutritious addition to your diet. Consuming food that are rich in iron will prevent your iron levels from becoming too low during menstruation. According to a 2012 study, omega-3s can reduce the intensity of period pain. A 2014 study showed that omega-3s can also reduce depression. For those who experience mood swings and depression around menstruation, omega-3s may be helpful. Turmeric. Turmeric is known as an anti-inflammatory spice, and curcumin is its main active ingredient. A 2015 study looked at the effects of curcumin on PMS symptoms and found that people who took curcumin had less severe symptoms. Dark chocolate. A tasty and beneficial snack, dark chocolate is rich in iron and magnesium. A 100-gram bar of 70 to 85% dark chocolate contains 67% of the recommended daily intake RDI for iron and 58% of the RDI for magnesium. A 2010 study found that magnesium reduced the severity of PMS symptoms. According to a 2015 study, people with magnesium deficiencies were more likely to have severe PMS symptoms. Nuts. Most nuts are rich in omega-3 fatty acids, and they're a great source of protein. They also contain magnesium and various vitamins. If you don't want to eat nuts on their own, try nut butters or nut-based milks, or add these ingredients to your main meals. Lentils and beans. Lentils and beans are rich in protein. They're also rich in iron, which makes them great additions to your diet.
So, boys and girls, we have now learned about the menstrual cycle. It is very interesting, right? What happens when the girl or the woman has irregular menstruation? Let's take a look. An irregular menstruation is referred to a condition where a woman does not experience menstruation every month or has too long or too short menstrual cycles. This might be caused by several factors such as an increase in body weight, hormonal imbalance, emotional disruption, excessive exercise, and it also can be caused by cervical tumor. Irregular menstruation can cause negative effects to a woman's health. The first negative effect is infertility. Infertility is sometimes caused by an irregular menstrual cycle and is an early sign that the woman may have problems with the reproductive system. Late treatment of this can cause serious health problems such as ovarian cancer, cervical cancer, and uterine cancer. The second negative effect is difficulty in carrying out family planning. Irregular menstrual cycle can cause a woman to have difficulties in determining her fertile day. So, this makes it hard to plan a pregnancy. And the third negative effect is anemia. Irregular menstrual cycles can cause a long period of menstruation. This can result in excessive loss of blood. The body will become weak and the woman might faint easily. Okay, pupils, now let's talk about hygiene. It is important for women to take care of their personal hygiene during menstruation. This is to ensure that the reproductive system is not infected with microorganisms such as bacteria, viruses, and fungi. Girls, how do you manage your personal hygiene during menstruation? Let me give you 2 ways how personal hygiene can be maintained during menstruation. Firstly, during menstruation, a woman must change her sanitary pad 3 to 4 times a day. Why is this very important, pupils? This is very important because doing this will prevent the infection of bacteria and viruses that might cause urinary tract infection or UTI. So, pupils, what is the next way to maintain personal hygiene during menstruation? You are right. A menstruating woman is encouraged to bathe frequently to clean her body. Okay, boys and girls, time for evaluation. Question number 1. What is the meaning of menstruation? Yes, you are correct. Menstruation is the breakdown of the lining of the uterine wall which is discharged together with blood, unfertilized ovum and mucus through the vagina. Question number 2. How many phases are there in a menstrual cycle? List down all the phases. Good job! There are 4 phases in a menstrual cycle. The first phase is the menstruation phase. The second phase is the repair phase. The third phase is the fertile phase. And the last phase, which is the fourth phase, is the premenstrual phase. Now, let's take a look at question number 3. What is the relationship between the fertile phase and the process of fertilization? Yes, that's right. During the fertile phase, the ovulation process will occur and fertilization is likely to occur if sperms are present. Now, we have come to the last question. A menstruating woman cannot drink cold water, eat ice cream, wash their hair, or play sports. Is that statement true or false? Yes, excellent. The statement is false. The menstruating woman can carry out their daily activities as usual. But remember, they have to take care of their personal hygiene during menstruation. Well, boys and girls, we are almost at the end of today's lesson. Before I go, let's take a look at what you are able to do now. You are now able to 1. Communicate about the menstrual cycle and the sequence of changes in the uterine lining during menstruation. 2. Relate the fertile phase of the menstrual cycle to the process of fertilization. And 3. Justify the importance of personal hygiene during menstruation. Boys and girls, I hope you enjoyed today's lesson. Goodbye and stay safe.